Hi everyone, I'm Dr. Jane Fernandez. I'm a general physician. This video is created for teaching purpose only. The topic of discussion today is delivering bad news using SPIKES protocol. SPIKES is a 6-step protocol published in the journal The Oncologist, Volume 5 in August 2005. The case scenario we will discuss today is that of amputation. Amputation is a life-changing experience that will affect a patient's ability to move, work, interact with others, and maintain their independence. Therefore, delivery of this news can be met with strong emotions. Until these emotions are cleared, it will be difficult to go on to discuss further steps of management. So let's take a look at the 6 steps of SPIKES protocol. The first step is setting. Arrange for some privacy. The privacy is given to you in the interview room. Involve significant others. Most patients want to have someone else with them, but this should be the patient's choice. So ask the patient if he would like to bring in a family member to the room. The patient most probably will respond that he or she came alone, but you get a point for asking. Make connection with the patient. Maintain eye contact, but do not stare at them. The second step is perception of condition or seriousness. Before discussing the medical findings, use open-ended questions to create a reasonably accurate picture of how the patient perceives the medical situation, what it is, and whether it is serious or not. For example, what have you been told about your medical situation so far? Or what is your understanding of your medical situation so far? Listen to the patient's level of comprehension. They could be in denial and say everything is perfect. Accept but do not confront at this stage. Based on the information, you can correct any misinformation the patient might have and tailor the bad news to what the patient understands. The next step is invitation from the patient to give information. While a majority of patients express a desire to full information about their diagnosis, prognosis, and details of their illness, some patients do not. So a good question to ask here would be, how would you like me to give the information about your condition? Would you like me to give all the details of what's going on and what we've done so far, or would you want me to spend more time discussing the treatment plan? At this point, if the patient says that he doesn't want to know the details, accept patient's right not to know and offer to answer questions later on if he or she wishes. The next step is knowledge, giving medical facts. Warning the patient that bad news is coming may lessen the shock that can follow the disclosure of bad news and may facilitate information processing, but give the good news first. For example, you can say, a team of doctors from various specialties such as internal medicine, orthopedic, and endocrinology have been treating and monitoring your condition. The good news is that you are out of danger at the moment. If it's a cancer, you can say the good news is that it has not spread to the lymph nodes. Then go on to say, but unfortunately, I've got some bad news to tell you. Or, I'm sorry to tell you that despite our continuing efforts, the infection has now begun to spread, and it is very important to stop the spread before the bacteria infects the major organs such as the heart, kidney, liver, and lungs. After considering various treatment options, the team have come to an understanding that the only way to effectively control this spread is by cutting off the infected and the damaged part. At this point of conversation, you must pause to elicit a response from the patient. Next step is to explore emotions and sympathize. First, observe for any emotion on the part of the patient. This may be cheerfulness, a look of sadness, silence, shock, denial, anger, anxiety, depression, or fear. Second, identify the emotion experienced by the patient. If the patient appears sad but is silent, use open questions as to what they are thinking or feeling. If the patient says he's frightened or is anxious, explore that by asking, "Could you tell me what you're worried about?" When emotions are subtle or indirectly expressed, as in a disappointment or anger, you can still use an empathetic response as, "I can see that this is upsetting news for you." After you've given the patient a brief period of time to express his or her feelings, validate their emotion by saying, "I know that this isn't what you wanted to hear. I wish the news were better." After you've explored the emotion of the patient and empathized, move on to the next step, strategy and summary. Ask the patient if they are ready to discuss further about the treatment options. Give the evidence for your recommendation and the benefits of doing it. Give the risk and consequences of refusing the procedure. Check the patient's understanding. Validate the patient's fear or concerns and reassure that you are on their side and want what is best for them. Then tell them that you will set up a meeting with the team of specialists such as surgeon, orthopedician, plastic surgeon, physiotherapist, orthotics, diabetologist, who will further explain the details of the surgery, rehabilitation, and the use of prosthetic limbs. At the end of discussion, ask them if they have any questions and reassure that you are there for them whenever they need you. So that concludes the SPIKES protocol. Good luck, guys.